Fertility Facebook page or our YouTube channel. Hello everybody on Facebook and our YouTube channel. It's so nice of you to join me on my Tuesday night Facebook Live. We are going to be doing a very special talk tonight called Getting to the Point, how acupuncture improves pregnancy chances. So, oh, hey, Vanessa. Welcome, Vanessa. I'm glad you jumped on. Hey, Christy. Good to see you. All my Instagram folks, would you jump over to Facebook Live, please? Hey, Caitlin. How you doing? Oh, that's my favorite. Caitlin Sage, Kirsten Puffer. One of my favorite names out there. Hey, Bria. Good to see you. Lindsay, good to see you. Quiana. Hi, Quiana. Hello. Hi, Sydney. Good to see you. Oh, three of my favorite, Amber Vence. Hello, three of my favorite people. So that's, we know who our daughter is, right? Say hi to everybody. Patricia, hello. Tila, that's a pretty name. Good to see you, Tila Tucker. Hello, Nicole. Hi, good to see you. Patricia, I'm already doing acupuncture twice a week. Good for you. Amber, hiya, Pops. Good to see you, Amber Kelly Martin. Good to see you. That's our daughter. Hey, Joshuman, that's our favorite doctor here from CNY Fertility, Joshuman Banerjee. He's here taking care of my patients, our patients, I should say. Oh, we've got Amber's going to fly out for another egg retrieval. Fingers crossed, we're fingering. And oh, Amber says hi, Mama. Amber says hi, Mama, to Diane. That's Diane's daughter, my daughter. And hello. Okay, there's Joshua and Kelsey. Okay, everybody who's on the Instagram, please jump over to Facebook Live. We're going to be doing about 20 minutes of PowerPoint to sort of get you in the mood. It's going to be question and answer. So Shiana Maria Lombard, you said you're going to see a consult to do IVF in Colorado and planning to do acupuncture. Fantastic. Well, we'll be talking about the American Board of Oriental Reproductive Medicine. We'll be talking about the Healing Arts Center at CNY Fertility. One of the things you have to know about CNY Fertility is we are an integrated practice, yoga, the Fertile Secret, the Fertile Feast. We're into foods, Kiltz's keto program. We're into the use of not only traditional Chinese medicine in the form of acupuncture, but we're also very much now going to be moving into the utilization of traditional Chinese medicine in the form of herbs. So that's going to be very exciting. We've done a lot of research looking at does it help, and it actually does. I'm going to spend a few more minutes till everybody jumps on. Elizabeth, am I in Colorado? Yes. And this is Elizabeth. I need help getting our recipient set up with you guys. It's going so slow, make our treatment delayed. So Elizabeth, what I would recommend is tomorrow, if you're having a delay, I'm not sure where you're having your delay, but if you're having your delay, just see if you can get through to Adrian at our office in Colorado. Just ask the call center to directly connect you and tell her what your delay is, and maybe that will help. All righty, Kaylin, nice to see you. Oh, Kaylin says, hi, Stephanie, I loved my session with you. This is Kaylin Anamundu. All right, that's Stephanie King. Now you're getting to recognize who they are. So Dr. Credenda, Diane Credenda, raise your hand, wave. Diane, wavy. There you go. That's the Diane. That's Stephanie. There we go. So we have both sides. So what I'm going to do is I'm going to jump in. Anybody who's on Instagram, please jump over to Facebook. And so what I'd like to do is have Diane Credenda sort of tell us a little bit about your history and why acupuncture. And again, we're going to keep it brief because we really want this to be a question and answer session. But just kind of give us a few sentences about yourself, please.
Sure. Hi, everybody. Diane Credenda. I was an X-ray technologist for 20 years and started falling through the cracks of Western medicine when I got sick, and I began to see an acupuncturist and basically saved my life. So I had a career change. Studied in Santa Fe, New Mexico, and I also spent 3 months in China. And then came here to Colorado because it was so beautiful and started my practice and met Dr. Magarelli after about 3 or 4 years.
And what is the name of your practice?
East Winds Acupuncture.
Okay. And that's been going for over 20 years?
Oh, 26 or so? Yes.
Nice. Fabulous. And who is the doctor sitting next to you? That's Stephanie King. Tell us about you, Stephanie.
Hello, everybody. I'm Stephanie King. I started out my academic career studying anatomy, physiology, specifically endocrinology of reproduction, and switched to Oriental medicine, learning about traditional Chinese medicine in hopes that I could really work with the regenerative capacity of the body more, and met Dr. two passions of mine together. So here I am with them. Very happy to be here.
Fantastic. Well, we're very happy that you're here. And so what I'm going to do, folks, is I'm going to sort of switch the screen here. And what we're going to do is we're going to do a very brief discussion of some acupuncture concepts. Here you see sort of the genesis of traditional Chinese medicine in IVF. It started back in about 1996 with Center Victorian's original work with blood flow. In about 2002, German scientist Dr. Paulus, he started looking at the application, not to the physiology, but to the actual practicality of using acupuncture with IVF, and was able to demonstrate a significant improvement in pregnancy rates when folks did the protocol that he had developed. And that then led to a series of studies that looked at randomized control trials looking at ongoing pregnancy rates and miscarriages. Another study in 2006 looked at, and again, the adverse effects, because again, with Western medicine, we're not 100% sure something is going to be completely safe with reproduction. Reproduction is not studied very effectively in humans because we are not allowed to. We're simply not allowed to do research with humans. However, with 5,000 years experience and tons and tons of safety data on the use of acupuncture in many other areas of pain management and other illnesses, we sort of stretched into this. This was a fertility and sterility publication. And the goal of that publication was to show that acupuncture didn't work, that it was a placebo. But lo and behold, they found that actually it was statistically significantly different, and the world changed. And then starting in 2007, Dr. Credenda and myself started doing very direct research with IVF patients. And literally, it's now spanned, it's hard to believe, it's spanned 10, 11, 12, 13, 15 years and many, many publications. And that's actually what drew us together to work together. As you all know, Dr. Kilst and I have been best friends for 25 years. And as I stepped into the area of integrated medicine, he stepped in the area of integrated medicine. And now CNY is well known for its Healing Arts Center, fertility yoga. So this is a perfect fit. So there's that brief history. And here you see, I'll just read them. We started our original work with Dr. Credenda and myself. We're looking at IVF outcomes in poor prognosis or low ovarian reserve patients. We then looked at good prognosis patients, which are those who didn't have low ovarian reserve. Then we looked at everybody who came to our clinic. We have over 3,000 patients now. And then our goal was to look at the take-home baby rates rather than just simply look at pregnancy rates, but also things like ectopic pregnancy rates, multiple pregnancy rates. And then as a scientist, we wanted to find out why is this working? You know, what are we doing that's allowing this to work? I'm not going to go through the meta-analysis. I think those are a little bit heady, but I'm going to start here, Dr. Credenda, if you'd like. This was looking at the impact of acupuncture on IVF. Could you kind of walk through that with us, please?
Yeah, so if you see the bars, the bar graph, the the green bar graph are those patients who had acupuncture, and the yellow one is IVF patients who did not combine acupuncture. So you can see with the pregnancy rate, which is statistically significantly better, that's that point P equal 0.05, it went from 41% to, I think it says 66% pregnancy.
Yeah, 66%, yes. Yes.
Which is key a lot. And then if you look at the miscarriage rate, fewer miscarriage rates in the acupuncture group as well. Not statistically different, but numerically different. And then if you look at the ectopics, that was statistically improvement with acupuncture plus IVF, so fewer ectopic pregnancies. And interesting that many of the early studies just were looking at pregnancies. And I had an aha moment out running one day, and I said, well, they're all reporting pregnancies, but just doesn't mean you got pregnant. It means you're going to have a take-home baby. So I called Dr. Magna and said, hey, is there a way we can check to see of these women who got pregnant, who carried and brought a take-home baby? And so he said, oh, that's easy. And that's where we found a lot of the difference in terms of not just pregnancies, but take-home babies.
And then the other thing I'd like to point out, this was a large study. This is over 200 patients. And for those who don't know research, the original studies for Clomid, which is a drug used around the world for fertility, the original study was 7 patients. So a lot of times they criticize research for saying the studies aren't big enough, but we made sure that they were. And then I'm not going to ask you to walk through this. This is maybe for the acupuncturists who are watching. And we've readily shared this protocol, but you can, well, you may be able not to see this, but what we did is when we started doing the treatments, we wanted to understand everything. We wanted to understand, why the points were used. In the Paulus protocol, why did they do the right shen? Why did they do the left side uterus? Why did we do these different points so that I, as a non-acupuncturist, would be able to present this to a Western research group and allow them to say, okay, this makes sense. And again, we're not here to teach about acupuncture, but my point is, with over 4,000 to 5,000 years of nomenclature and the definition of points and seeing how those points in true fact affected folks, that's how the Chinese built this, on observation. And so we took those, or I should say Dr. Credenda took those and said, okay, these make sense, and this is one of the protocols called electrostim. So tell us what this is, Diane, if you wouldn't mind.
This is one of the first acupuncture published papers, and Stena Victorin, who you saw her name earlier, she's not an acupuncturist, she's a neuroscientist. And so she studies what happens to the chemicals in the brain, neurotransmitters, when patients have acupuncture. And so she had a huge interest in this. And so she developed this protocol, and basically this is the one that increases blood flow through the uterine artery. And as you know, when you're taking your stim meds, those medications are in the blood, and they're being delivered to the ovaries through the blood. The more you have, the better the eggs are nourished, and all that those beautiful hormone food is being fed to the eggs.
Are you and Dr. King still doing this type of therapy on folks?
Yes, we've modified it a little bit over the years. We now are also treating the side effects of any stim meds, headaches, nausea, because we did this as a study. We couldn't deviate from the acupuncture points. So this is where we began. Now we've branched out quite a bit.
Okay. So those are the electrodes, positive and negative, and it's a little battery, right? This doesn't electrocute you. That if I look at this, I'm worried about that I'm going to get electrocuted.
It's a 9-volt battery.
Okay. Okay.
No,
I'm just checking.
No, it's a 9.
Just checking. All righty. So again, this is some more of the theoretical points, and for us in Western medicine, it really they're interesting. They're a different nomenclature. They're different language, but maybe Stephanie, are you familiar with the Paulus protocol?
Yes.
And so,
would you like me to?
Yes, talk about it.
Yeah, absolutely. So the Paulus protocol has two parts, both the pre-embryo transfer treatment and the post-embryo transfer treatment, both of which are based on a foundational protocol, but we've worked to modify those as well for our specific patients and for what they are going through with their in their journey with their process. And what you're seeing on the screen there is the foundation protocol and points that are used for the pre-embryo transfer.
And then this would be the post-embryo, right?
That's correct.
That's the post, yes.
And in principle, what was he trying to do? What do you think Paulus was trying to do with these points?
Yeah, can we go back to the pre-embryo slide as well?
Yes.
Dr. Credenda, do you want to talk a little bit
about
that?
Yeah, I just want to point out on your screen to the right, it says ST29. It says coming back. So all the Chinese names have Chinese names, but when they're translated. So another name for that point is return to the nest.
Oh my gosh. Oh my gosh.
Very low. It's almost a pubic bone right over the uterus. And so I get goosebumps when I talk about it. I always tell the patients, okay, I'm doing this point. This is a return to the nest. This is a nest for your babies, right?
Right.
So it's interesting. So that was a point that they chose. And then, of course, liver 3, our liver gets, you can imagine the liver has to handle a lot of hormones and medications. So liver 3 just helps calm the mind, regulates the blood, opens the channels for better circulation so the liver isn't hanging on to excess. And then, of course, the spleen is what holds things in our body. The spleen creates our blood, just like Western medicine. So, yeah, it's interesting.
It's funny to look back at this after years and years and years and see what how we started this so many years ago. And is it my understanding that in a Western way of thinking, it calms the uterus, and when you put an embryo inside the uterus can start cramping and also can start wanting to push things out. That's how you have a baby come out. So it was my understanding that this would help reduce those quiverings, as it were.
Sure.
Okay.
I think additionally with that treatment that we use, which you're about to lead into here, is the auricular acupuncture, which can be something very kind of special that patients can take with them as well through their transfer, with the whole body being represented in the ear and using specific points that help to relax that uterus and to regulate hormones with that endocrine system.
Just for my own sake, the Shen Men?
Yes, that's calming.
Okay, all right. Calm your Shen.
And we have,
of course,
tiny tacks that we put in when they come in for their pre-embryo transfer. And so they leave those in for like 2 to 3 days. So during the transfer, your team is fabulous. They say, okay, if you have tacks, push them. So now
yes.
we have them like pushing their little things to help calm the uterus down, to help their brain calm down, energy calm down. As you know, if we're calm, everything works better.
Well, I have seen some of my patients who say they're doing acupuncture, but when they come in, they don't have the ear tacks. What does that mean?
It might mean that other acupuncturists aren't using the tacks. They might be just putting the needles in.
But is this part? Oh, I see. They put the needle in, but they don't leave a tack.
Right.
Oh, good. But this is all part of the protocol.
No, we've developed over the years.
Okay, fantastic.
Something to really think about.
Now, let's tell us about this study that sort of changed. This was actually the pre-study, because I don't know if I have a picture of the post-study, but want to go over what this study is representing while I get Instagram up here?
A better slide here in front of you, but basically, so this is 147 ladies, and these are the poor responders. So elevated FSH, been trying to get pregnant long time, maybe male factor. And so, you can see the bar graph in terms of pregnancy. Those who had acupuncture with the yin-yang symbol compared to no acupuncture, pregnancy rate was not statistically different in this group.
It's a smaller group. It was only 147 people.
I have a different slide here that showed significantly different, but
I'll show you later. I'll show you later.
Fine. And then also just fewer miscarriages, and then 0 ectopics. And then birth, there's that take-home baby is that middle group where you see the birth per pregnancy. So that's where it statistically significantly goes from the IVFers who didn't have acupuncture had 57% pregnancy take-home baby, and then the acupuncture group was 68% take-home baby. So that's where you see the real impact of acupuncture.
The other thing that always got me surprised, and it's still kind of persisted over the decades now, is the fact that in those patients doing the acupuncture, I still don't understand why they don't seem to get ectopic pregnancies. I still can't understand that.
Can you do that one?
The ectopic pregnancies.
Yeah.
Sure. So why the ectopic pregnancy rates are so much lower in the acupuncture group? When we're looking at a lot of the protocols that we do and everything, we have specific points actually that have been shown to help open and to relax the fallopian tubes. And so that, in addition to increasing blood flow and relaxing all that viscera surrounding the tubes, can help to really keep them open and to prevent proper movement, the flow of qi, flow of blood through that organ.
So this is a known phenomenon.
There it is.
I love it. Okay, so this is just showing that there was 11% more live births, and that doesn't seem like much when you think about it, but in the United States, it took us over 15 years to improve our live birth rates 11% without acupuncture. So this was instantaneously. Within 1 year, we were able to do that for those folks. And now here's the rest of the data on the low responders, part 2. And this is what Dr. Credenda was talking about. And here you see, once we really broke out the data into 3 segments, which was the control was IVF alone, of course. Then we had the low responder who just was IVF alone. And then we compared the low responder who did acupuncture and IVF. And what we found there, as you would expect in the blue there, was that pregnancy rates fell because compared to the general population, because they were low responders. So that made sense. But if you look at those low responders that added acupuncture, it sort of self-corrected. It was very, very interesting to see. I had never seen anything in our literature like that. And then this is the running day. This is where Diane called me up and said, hey, what about the babies? Because she was a little disappointed because the pregnancy rates in the low responder didn't beat out the non-low responder, because that's how we saw it. And lo and behold, when we looked at live birth rates, it sort of changed and rocked our world. So this kind of led us down a rabbit hole of study after study. I think this was just the good prognosis patients. And I'm going to kind of move this along, folks, just so that we can get to the questions. And folks, we are going to be answering anybody's questions. Here we looked at good responders. And what's interesting is if you're a good responder, you're a good responder with or without in terms of pregnancy, with or without acupuncture. But even in the good responders, we had statistically significantly more babies. That's the births per pregnancy. Miscarriage rates were lower, and of course, ectopic rates were lower, and you can see that. Not as dramatic as the poor responder, and I have many, many patients with, we now call them low ovarian reserve, poor ovarian reserve. We have, I think CNY is famous now for helping everyone, and we have many patients that they're sort of not given the choice at other places, but for us, we take care of everyone. So in particular, I think the studies that we have looking at poor responders plays a big role for our patients. And then again, we looked at all patients, which was getting larger and larger data sets. In that case, we did have better pregnancies, but in this particular study, we didn't have significantly more births. We just had numerically more, but again, ectopics were few and far between. And then again, we expand the study now to 500 patients. This one was 200 patients. But again, when we looked at 500, 3, 4, 5, almost 600 patients from 2002, we saw the significant increase in pregnancy rates. And of course, that leads you to births. And again, in this all patients, you have poor responders, good responders, etc. And then talk about this one. This is a surprise one, Dr. Credenda.
Yeah, so it was interesting because as we were conducting the data, we kept coming up with more questions. What else can we look at? And so one of my questions back then was, is it making a difference in multiples? And I think the next one, if we continue, we'll see, are they male over female? That would be another interesting one.
So, we haven't done that.
Well, we presented this research at a Western conference, and I had a couple of reproductive endocrinologists.
Well, tell us what this says, though. First, tell me what this says.
What this says is the women who had acupuncture had fewer multiples.
Now, some people would say that's a bad thing. They want twins, triplets.
A lot of my patients will say, don't do that point, that, because I want to have twins. I want a twofer. But, we were challenged on this at this conference. And basically, my response was, in Chinese medicine, we regulate the body. We return the body to homeostasis. A woman is meant to have one healthy baby. And of course, now with Western medicine, we can handle more, but our biology is to have one healthy baby. So I think it's just returning the environment, the woman's body, back to homeostasis, which is what we're supposed to have, is one baby.
So this is basically in traditional Chinese medicine, and also in humans, we have one uterus. We should have one baby at a time, right? That's basically what it's saying.
Right.
There's a question here by Amber Charlton, just a quick one. She's triggering tomorrow for Retrieval Friday. Can I request acupuncture at a last minute? Amber, tell us where you live, and I'll see if we can help you there. Now, this was pivotal, and I think you both should spend a little bit of time explaining why this particular slide matters, which at first glance doesn't make any sense, but if you could kind of tell us why this matters so much.
Right. So we know that acupuncture is accumulative, just like physical therapy. If you have shoulder surgery and you have one or two treatments, you're not going to get the results that you're looking for. So this was this is just a way to do research. So we said, okay, how many treatments gave the best outcome? And so it turns out that it's 8.5. The standard, that's the E-stim treatment that we showed you earlier. So it was 8.5. So we said 9 treatments is optimal to help the blood flow and get the medications where they need to go and nourish those eggs.
So what the critical point here is, what I'm hearing is, it isn't a one shot. It's like anything else. It's like training for a race. You don't just run once. You should plan for this. Typically and we'll kind of go on a little bit here, and I want to kind of keep moving here. So overall, folks, basically impact is fewer miscarriage, fewer ectopics, more pregnancies, fewer multiples, and most importantly, more take-home babies. I'm going to go beyond all of this because I really. So then we got to the question of, okay, now that we know it's working, exactly what's working and how it's working. And so you want to jump on this slide here.
Sure. So if you look at this slide, you can see that the red are the controls, who are the IVF ladies, and the blue are the acupuncture plus IVF. And you can see those first 1 to, about 5 blocks are kind of within the same levels. And then if you look straight down from there, you can see the numbers 2, 3, 4, 5, 6, 7 at the very bottom. So you can see that the red and the blue begin to split off around the 6th treatment. So the treatments at the bottom are the number of treatments. So we see here, after 6 treatments, things begin to change, which is putting your body into a more fertile state, because the medications tend to bring things down. We found out that cortisol is needed for implantation. It's a very active thing. It's like, I need cortisol when I'm running a race because I want to get to the finish line. So this is a normal fertile cycle would have this rise of cortisol around mid-cycle, around ovulation. So this is just demonstrating the point about its acupuncture is accumulative and takes a little while for it to change. And you'll see it on the same pattern on the next slide.
So and that would be prolactin, right?
This is the prolactin. You can see about maybe 6th or 7th treatment is when the blue line and the red line kind of split. So that's 6th or 7th acupuncture treatment, and is when the prolactin is being drawn down. You can see in the red line there, that's the IVF medication. And then with the acupuncture, it's kind of offsetting that drop. It's keeping it at a more fertile state. Make sense?
Yes, ma'am. Yes, it does. Other benefits, of course, one of the things we looked at is by doing acupuncture, what you found. Now, this is old data. That was looking at, this is 2006 fees. Right now, our fees are much less than that, but the differences are still there. That by doing acupuncture, you actually save money because in reality, you do fewer IVF cycles. There are studies showing you use less medication. And then you have, of course, fewer miscarriages. So financially, it helps. This is just a way of looking at the treatments. You need to get a certain number of treatments, and I'm going to kind of show you them here because I want to get to some questions. And would you explain this one, Stephanie, kind of what we're trying to say on this slide here?
Yeah, absolutely. So you're looking at a timeline, basically, 27-day cycle, if you will. The green bars represent the frequency of treatment that you're going to need for those acupuncture electrostim treatments. So you'll get 9 treatments before you go for your egg retrieval. Something I wanted to mention too for people that haven't had it, and especially looking at the photos presented earlier of the e-stim setup, can look a little bit intimidating. So seeing having to do that 9 times, not as intimidating as it may seem. So then you'll get to that egg retrieval. Eggs will be taken out, fertilization and everything through CNY, and then you'll have your pre-transfer and post-transfer treatment indicated by the yellow arrows surrounding your transfer, whether that be same cycle, next cycle. Yeah, so that's just the bigger picture of the 13 treatments that you'll need.
Yeah, and I'm sorry, the way I drew this, it seems like you have to do them over the first 9 days of the cycle. Of course not. This is the best thing is 3 months before. You usually want to try at least 4 to 6 weeks before your egg retrieval and starting your cycles. You like to do 1 or 2 cycle treatments per week, more or less, or even 1 a week if you have enough time. And what do they call those things after they get the needles?
Needle naps.
There you go. Okay, needle naps. You go right to sleep. Other areas that I think are so critical and we don't spend a lot of time because everybody talks about pregnancy is ovarian hyperstimulation syndrome, recurrent pregnancy loss, pelvic pain syndrome, polycystic ovarian syndrome. Anything that has the word syndrome in Western medicine means we don't 100% know why it occurs. But in traditional Chinese medicine, its differentiation of syndromes is actually the definition of their medicine. So from a synergistic standpoint, there are so many ways that I have found in my practice by adding traditional Chinese medicine in the form of acupuncture and hopefully now in the form of herbs that we're going to be able to help a lot of our folks. Now, I know I'm kind of moving things along. We could be at this for about 5 or 6 hours. But what I'm going to do now, thank you very much, is I'm just going to put us on our pictures here. So I'll start reading some of the questions, and please, anybody who has questions. Okay. Can acupuncture help with incompetent cervix and miscarriage prevention?
Yes, depending on what's happening. Sometimes that's the case for Eastern and Western to both work together.
Okay. Let's see. What's the difference between fertility-wise between massage and acupuncture?
Sure, absolutely. So both are great therapies which are offered through the Fertility Arts Center and CNY. What we can do with acupuncture is something that massage can't do is energetically connect a lot of the energetic channels within the body. We can go a little bit deeper as well to access, closer to the nerve roots, especially using e-stim as well. So we can make anatomic changes in the body.
Okay, I have Caitlin Sage Kirsten Puffer, my favorite patient's name, longest in history. I want to do acupuncture, but I can't find one locally that will do your protocol. There are only 2 clinics and they won't do it. That's really odd. I'm sorry to hear that. Can I cram in a crash course when I get to Colorado before retrieval, or can you help me find someone, please? I'm in Wisconsin. We have good friends in Wisconsin that are ABORM members. Go to the ABORM. Yeah.
Are there an ABORM? So if you can't find anybody on the ABORM website, I would say any acupuncture is better than no acupuncture as preconception care. If they're a licensed acupuncturist and they have to have an NCCAOM after their name, not a chiropractor, an acupuncturist who's had 3 to 4 years of schooling, they'll know what to do. And then when you come here, we can top it off with whatever else you need.
Well, she should call ahead of time to make appointments, right? Go to the East Winds Acupuncture.
Let us know when you're coming.
Yeah, and go to East Winds Acupuncture website, eastwindsacupuncture.com, and start making your appointments now. Will acupuncture help women age 40 and over to succeed in IVF?
Yeah, so with acupuncture, we're always working with the body's resources and working to harmonize them and to really work to regenerate what's available, the jing, the yin, the qi within the body, to harness what you have and make it work functionally. So regardless of age, we can help benefit who you are and where you are in the process.
Kelly asks, is there a protocol that you can give to her acupuncturist? Should she contact you guys directly, have her acupuncturist contact you?
Yes, just email info@eastwindsacupuncture and we send the protocol. And I just want to back up a little bit, just to expand what Stephanie says. Is one thing is this preconception care is key, especially for the older gals, is because we have 3 months to work with their environment, the environment of the eggs. Of course, I'm an athlete. I would never show up at a race without having done some training, right? Because I might get halfway, but I wouldn't get to the finish line, which for you guys is a baby. So preconception care is really important. Your supplements, dietary changes, lifestyle changes. And I think in my practice, I've gotten 2 46-year-old women pregnant with no high-tech stuff. So there's science and then there's nature. Sometimes you just need to balance and focus.
Is it too late to do acupuncture if my egg retrieval was already done?
I'd say absolutely not. With your retrieval being done, that is looking for a transfer in the future. So there's so much more that we can do to help you build the lining of your uterus and prepare your body for a successful implantation.
So you do recommend acupuncture before and after retrieval as well as the transfer? Yes.
Exactly.
Yes. In Buffalo, okay. I'm coming to CNY, Colorado in a few weeks for a frozen transfer. I can get acupuncture weekly. Should I make an appointment at East Winds for my pre and post transfer appointment, or will my weekly sessions be enough?
Give us a call and we'll time it for you. You let us know when your transfer is going to be and we'll recommend the timing.
Okay. Is there any acupuncture that will help male factor? There's a question.
Yes, absolutely. Just Google acupuncture and male fertility. It's kind of a lost art, I think. I feel like we work a lot on the women, the ladies, and it's not just the ladies' issue. So we're trying to encourage our guys to come for acupuncture and herbs because it takes 2 to make a healthy baby. Healthy sperm, healthy egg makes a healthy baby.
I have diffuse adenomyosis and 2 miscarriages early before the heartbeat. I feel it's my uterus and maybe blood flow issue to support the embryo because of implantation does occur. Would acupuncture help with adenomyosis and blood flow?
Depends on how baby is.
Yeah, it sounds like you've been working with Western doctors as well for that diagnosis. And so moving forward with your reproductive endocrinologist, you can absolutely work acupuncture and herbs to do things like move stagnation in the body, which is what's leading towards that accumulation.
I'm just clarifying. Yes, it's info@eastwindsacupuncture.com. Absolutely. That's if your acupuncturist wants to just or just email her, they will be happy to send the protocol. And the protocols, if you go to the eastwindsacupuncture.com site, all of our research is on there. So they can actually, if people say they don't want to use the protocol, they can actually look at the protocol and see exactly how it's done. We've published it many, many times. Kaylin says, I noticed with my sessions after transfer, I had a more intense cramps, maybe an hour or so after. Is that normal?
After the transfer?
No, after her I've noticed with my sessions after transfer, I had more intense cramps. So
uterine cramps?
So uterine cramps. I think that's more dehydration. And maybe you're overdoing it, but is there anything, maybe that's the question, is there anything about the acupuncture that's going to increase your chance for miscarriages?
No, if you're seeing a licensed acupuncturist, there are certain points that we do not use when you're trying to get pregnant during certain times of your period. We avoid certain points.
Okay, so there it's been proven now over 20 years, and now thousands and thousands of patients have done our protocol as well as other protocols, that this does not increase any kind of untoward outcome like a miscarriage or not getting pregnant. So again, my biggest concern when I first was introduced to this, will it do harm? And I think we now have over a decade of data which says it does no harm. And then, of course, does it help? And I think we have significant amounts of literature that says it does. Yeah. Jessie says, I have very poor circulation to my ovaries and insurance doesn't cover acupuncture. Can I use a TENS unit to help at home? If so, where should I place them?
Yeah. That's the tricky part, is coming to us so that we're sure that it's placed correctly. Dr. Cadenda just talked about, there are certain locations in the body that can be dangerous or harmful to pregnancy. So making sure you see somebody that is certified and make sure the placement of those is correct is pretty important.
As they say on TV, don't do this at home. We are professionals. This is a professional driver. Don't try this at home. Ellen
there is a femoral massage you can look up online, that you actually hold your femoral artery one at a time and block it and then let it flush through, and just make sure you're careful. You should never do it around ovulation, around your period. So you can look it up, femoral massage. That's something you could do at home safely.
A little shout out from Elaine Troy. Dr. Cadenda, I am halfway into my pregnancy and still go to the acupuncture as you recommended in your other video with Dr. M.
Awesome. Congratulations.
Isn't that great? Okay, how are my Instagram people doing? I guess everybody jumped over to the Facebook Live. Jesse Wild says, thank you. That was the one with the poor circulation question. So other things you'd like to talk about? The questions are slowing down, which happens as we go through the talk. So what other things would you like to bring to our attention? Are there things that we can do that you in particular would recommend? Maybe each of you give us a few minutes of your thoughts.
Yeah, absolutely. I can go ahead. I just wanted to emphasize the importance of coming to see us early. Even before you start your journey with Dr. Magarelli, or while you're waiting for your appointment with CNY Fertility, it's really beneficial to get started early so that we have time to make changes in the body. It is definitely part of your journey, and everything that we do will build up to that, to that final moment when you get to work with CNY Fertility for your assisted technology.
Yeah, and also we know biology. It takes about 3 months to make a difference in the quality of your eggs. So I have patients come and say, I'm smoking. I'm going to quit smoking tomorrow, and then I'm having an IVF next month. What she doesn't realize is that all those eggs are still under the influence of the cigarette smoke. So she has to wait about 3 months. So that's what we talk about. Preconception care gives us time to nourish the egg. And one thing we're really efficient at is helping with lifestyle changes. Dr. Kiltz and CNY really they're into the anti-inflammatory protocol. Well, how did we get so inflamed? Too many carbs, all sugar, takeout food. So we work very closely with that as well. If we have time, that's what Stephanie was just saying. We need a little time with you.
So there's a question here that I want to interject. Is a protocol or approach different for IUI cycles? Or should you do it for IUI cycles?
Absolutely. It's just timed differently because we know it takes 3 to 5 days for that oocyte that's being ovulated to come through the fallopian tube, and implantation would be very different. So we time it differently and do slightly different points, custom points.
How far in advance should we do acupuncture for frozen transfer?
I would say 2 months or 3 months, just depending on if you need a lot of work with your lifestyle.
Well, you haven't met my patients. They're not going to wait 2 or 3 months.
No. Oh, well, okay. So typically our protocol is after the retrieval, we see our gals once a week leading up to their frozen transfer. Sometimes that's 4 weeks, sometimes it's 8 weeks. So once. Okay.
How far I'm sorry. Are there any particular Chinese herbs you recommend? I kind of feel that's a little too broad a question. We maybe do one on Chinese herbs at some time, but if it's okay with you guys, do you have any warnings about Chinese herbs? Maybe that's a better question.
Yeah, so there's definitely a lot of herbs that have estrogenic, progestogenic properties. And so we do need to be careful with what we prescribe and who we prescribe them to. A lot of herbs energetically are too hot, too cold, and can have negative effects on pregnancy. So, and it's not something that is like a supplement that may be recommended to everybody going through their fertility journey. It's something that also needs to be very customized to your constitutional patterning rather than just the nature of trying to conceive.
Okay. I take a lot of herbs. Should I stop while stimming? Caitlin, I think this is my favorite Caitlin Sage, Kirsten Puffer. Well, I would say be careful. A lot of herbs that you get over the counter, if they're not from a traditional Chinese medicine herbologist, the ones over the counter are really for premenopausal women and postmenopausal women. They're not really fertility herbs per se. I hope you can correct me if I'm wrong. Commercially, the stuff that you can get at the Whole Foods or Sprouts or something like that, they're not going to be specific for fertility, but they're like for women. And usually the women are things like, they're spotting or they want progestin in it. That may be ill-timed, and it may really mess up. And it actually can mess up our labs, which make us worry about canceling your cycle. So I'd strongly recommend, unless you're seeing, someone who's extraordinarily well trained, like the folks at the Healing Arts Center or the ABORM, certainly is Dr. King and Credenda, you be very careful about the herbs. Am I overstating it, or is that what you're saying?
Please prescribed. We can have 5 people in one day with a headache, and they might all get different herbs. So.
Yeah, Caitlin, you're taking hypothalamus extract. Glandulars, unless Dr. Verdialis, who's a naturopath, has recommended those, and again, I don't know much about them, like Catalin, Cataplex, hypothalamus, black currant seed. These are the ones that she's taking. Okay. I would say it's in this format, it's very difficult. I would follow Dr. Credenda and Dr. King's recommendation, which is, let the professionals choose it for you, and as long as they're versed in the management of fertility, that's great. All right. Elaine Troy said, and this is the gal I think who's pregnant now. At least my TCM practitioner told me not to take any during stimming. So that's person is aware. Yeah, so Caitlin said she's going to pause her until she talks to someone. So she's taking our advice, and this is the best we can expect from our Facebook Lives here, is for you guys to take our advice. But we hope you use it. Okay, here's a question from Jessica. Jessica is one of my star patients who helps. She always will write things and help while we're having these lives. Is there a difference between the effects of fertility massage, difference between the effects of fertility massage and acupuncture?
Yeah, I think we touched on that a little bit, and I think both of them are very separate arts. I don't have data here to specifically address the effectiveness of fertility massage. However, biased or not, I would say that the energetics and anatomy and physiology that we're using going into producing our protocols is extremely comprehensive and has thousands of years of research behind it. So,
yeah, I think the modalities are different. I think with massage, your main goal is removing tension and increasing blood flow, which is excellent. But it's typically, unless it's really Mayan or very deep massage, typically it's more superficial musculature rather than anatomical parts like the ovary. The key thing with the Paulus protocol, the Center Victorian protocol that we talked about, is in Western medicine, we have no way of improving blood flow from the uterine artery to the uterus. And Center Victorian was able to demonstrate that it was traditional Chinese medicine that was able to actually reduce the resistance, thereby increasing the blood flow, thereby making the drugs more available to the ovaries and the hormones more available to the uterus and the growing baby, that the difference became significant. So again, there's not one medicine or we're very much into as many modalities that are patients, and that's why we have yoga, we have massage, we have nutraceuticals, the molecular fertility nutraceuticals. We have acupuncture. At CNY Fertility, really, it's looking at the medicine as a whole, as complete. In other words, every modality has some value as long as you look for it. And by adding together with other modalities, what we're hoping is they synergize and basically put everything together. And as Jessica say, integrated medicine. I mean, integrated. And what's the goal of integration is to produce an effect optimally for our patients every time they come in.
Yeah, and I just want to add something to that is something you guys may not know is when the needle goes into your body, it accesses your nerve bundle. And that's why Stanley Victorian, right, who's the neuroscientist, realized that when the needle goes in, it actually changes the message to the brain, changes chemicals. So it's actually programming your body and helping the loop, FSH, LH, right, hypothalamic pituitary ovarian axis. She demonstrated that. So massage probably feels good, and it's great for relaxation, and that's important. But we actually can affect the nerve bundles and brain chemistry. Make sense?
So there's a question here. Has acupuncture shown positive results in the preparation to conceive for, let's say, an IUI for PCOS patients? Are there things you can do for PCOS patients differently, or are there treatments that you guys can manage with we've got quite a few PCOS patients, and so this is a very important question.
You want to take that?
Yeah, so PCOS is one of the things that we really focus a lot on here, because we do have a lot of patients that come to us struggling to conceive with PCOS. And there are very specific protocols that we use also that have been well studied and published to help people, as well as managing supplements and vitamins to help as well, is something
my understanding is that there's we call it PCOS, but in actuality, in Chinese medicine, it may be 20 different syndromes that we in Western medicine jumble together into one pile called PCOS. We have lean PCOS, we have obese PCOS, we have all these names, but tell us a little bit about that, just a little bit about what the difference is there and why it helps.
Yeah, so we work a lot with food and what we know about carbohydrates. So PCOS is nothing but insulin resistance. So ladies can have cystic ovaries, they can be anovulatory, they can have hirsutism hair where you don't want it. But the one thing that all PCO, whether they're heavy or thin, have is insulin resistance. And the best thing to do with insulin resistance is to get off the carbs.
Well, I'm talking specifically in Chinese medicine.
Right. So we can do a lot of acupuncture, but if they're not changing what they're doing for that inflammation, because the sugar is causing a hormonal imbalance. So it's a lot harder for us to work with them. It takes a lot longer unless they really get rid of the carbohydrates and get their blood sugar under control.
Okay.
Yeah.
So I guess I was kind of gearing it towards the fact that by what I found fascinating as a reproductive endocrinologist and a nutritional biochemist is that even with all of that training, when you describe certain syndromes associated with illnesses that I have a name for, your perception of what's going on and what's wrong is different. And what I have found is with traditional Chinese medicine, by adding it to the Western medicine, we have more insight into what's going on with the patient if we collaborate with our brethren, the traditional Chinese medicine docs. And I will tell you that both personally and professionally, and certainly from what I've seen over the past now 15 years, I have seen miraculous results on patients that were a no, we can't help you, to a try acupuncture, to a try acupuncture plus us. And I think that's why we at CNY feel so strongly that you look at all these modalities. Look, as Dr. Credenda was saying, at the nutrition. And as Dr. King was saying, get to the professionals. We hire the professionals, so that you get that leadership and direction that's unambiguous. You haven't heard any of us say ambiguous statements. We're saying yes, no. That's what we're saying, so that you can have clear direction. I think for our patients, getting our males to come is probably critical, and I'm really working very hard. I've got lots of good data. I did a whole talk for an hour and a half on all about the male. And I brought up acupuncture. I brought up Chinese medicine. I brought up because we need help. More than 60% of our infertility is the male factor. Miscarriages, more than 50% of miscarriages are the male factor. Issues related to recurrent pregnancy loss, they are associated with the male factor. The consequences of our high-tech treatments, like reactions to medications, hyperstimulation. I think what I'm hearing from you all is we can help with that because we can look at it differently and help those patients, and we're going to help them broadly in our field. Many questions are, where do I find acupuncturists like you? That's the question. Where do I find them? Where do I find them? Well, certainly CNY's Healing Arts Center. These are well-trained acupuncturists who have access. We have the American Board of Oriental Reproductive Medicine, which Diane is a founding member, and has helped establish this. So now we have over 800 people around the world who have studied Western and traditional Chinese medicine. We are bringing more people into the fold, and I think these Facebook Lives, I would recommend to both of you, that you come back and and maybe we could pick a topic that you guys would like to sort of elaborate on, and really begin to get us all involved with things that we can do, as you mentioned, Dr. Credenda, our diets, our way of lowering our carbs, doing the right vitamins, avoiding the wrong herbs, those kinds of things. Sure. Well, we have about a minute or two, so could you guys want to say something as a parting shot here?
Yeah, it's interesting. There was a study done that looked at patients who went through IVF and had acupuncture versus just IVF. And what they looked at was how many patients would repeat an IVF cycle. And what they found was the group who had acupuncture were more likely to have that second IVF cycle because they had less side effects. The acupuncture helped with headaches and nausea. We hold their hands, we rub their feet. You know what I mean? They have this whole different sort of care system.
Sure.
I hear that every other day in my clinic, that these gals are reading blogs and how horrible they're going to feel, they go, I've been doing great. And I think it's the acupuncture that really makes a difference.
Before we jump to you, Stephanie, there is one question I want to answer. Is there any precaution with acupuncture for bleeding disorder patients?
Yeah, so, well, either of us can go
ahead.
with that. So a lot of times that's something that we always take into consideration as acupuncturists, and caution that we're trained to look for, especially with fertility patients that are using blood thinners. So that's something that we'll always ask and take into consideration. But, coming to see us, we'll ask you those questions so you can feel assured that we'll be ready and not do anything that might cause harm to you.
Okay, it looks like you're going to have the parting words. We're at 7:30, so take us out here, Stephanie.
All right, wonderful. Well, for those of you that are watching today because you haven't had acupuncture before, I think my biggest, you've heard the benefits throughout this talk, but I would recommend not being afraid. A lot of people avoid coming to us because they don't like needles, but the personal nature of the medicine, it really is an art, and we work with your comfort always in mind so that we can be effective, but also make it an experience that you will enjoy and want to continue throughout your fertility journey. So don't be afraid and ask us the questions you need to, and we're here for you.
Okay, folks. Well, thank you both, Dr. Credenda, Dr. King. It has been absolutely wonderful. I think from the comments here, everybody has, this was amazing. Thank you, everyone. I really want to get acupuncture, so I think that's fantastic. One of the things that I want to share with everyone is that at CNY, we're not afraid to ask hard questions and go beyond our comfort zones in Western medicine, traditional Chinese medicine. And the reason is that you guys matter. And we hope you share this. This is recorded, so if there are folks who weren't able to see it, please join us. And if there are any things that you do want to talk about, next week, of course, is question and answers, open mic next week. So it'll be all kinds of questions. And I hope you have a great evening. Thank you for sharing the time with us. This is Dr. Magarelli, CNY Fertility Colorado, Dr. Credenda and Dr. King, East Winds Acupuncture, Colorado, and all the folks at CNY across the nation. I thank you all for allowing us to spread the word about the value of getting to the point, which is that acupuncture will help you get pregnant. Thank you, Amber. Amber sending some kisses. Bye, everybody. Bye.
Bye.